So today I'm going to be treating the wrist using the Enraf Nonius Tecarpuls. Come into the wrist, going into wrist bursitis, and we'll have a look at the protocol here. As you can see, we've got level 8 for the starting intensity. That would be fine. I'm going to turn the amount of time down though to 4 minutes. If you have a look here, you'll see this isn't the biggest wrist on earth. And so I like to do 1 minute per treatment head size, so 4 minutes is going to be better for me. In this case, a thermal camera, you'll see we're hitting about, the hottest part about 29, 30, there in the centre of the wrist. We're going to bring the earthing electrode and just put it underneath the patient's arm. First of all, I'll put some contact medium on the earthing electrode, just to make sure that it's going to make good contact with the patient. So a little bit of contact medium and then spread that out. I'll put that under the patient's arm. It's convenient to put it under the patient's arm. Should go without saying, don't touch the earthing electrode with the actual probe though. A little bit of contact medium on the patient, enough to spread around the area and enough to have some reserve for when it dries out. There's a small treatment head. Better for a wrist really than the big one in most cases. So we'll switch it on here and start moving around in small circles. I'm actually keeping my hand over the up down arrows there. I've taken my thumb away just for the demonstration, but normally you would keep it over the down button. That's because the heat will build fairly rapidly in a small area like this, especially with the types of tissues that are in this area, and so you'll end up with the heat building quite quickly. So moving around in small circles. If there are any hot spots, just turn the machine down or move so that you're not going over that hot spot as much. Probably easiest just to turn it down in the wrist. Moving around in small circles. This is a 4 minute treatment, so we'll see you back at the end of the treatment and see what the results are. At the end of the treatment now, you'll see there's some redness in the skin, a little bit of flushing, erythema. I'll bring the thermal camera back in and we'll have a look. So if we look here at about a 2-degree increase overall, you can see the thermal map, how the heat is built up in the wrist where we've been treating there. You can use this as the same protocol for doing carpal tunnel syndrome from the other side. Best used in chronic cases, not acute bursitis though.